It's not bad. It's not bad. Oh, it's got the tears going though. Hey, howdy everybody, this is Dr. Neil Guymon, Dr. Eye Guy, and I do videos all about the eyes to help you with your eyes. And I really enjoy doing these videos specifically about dry eyes, dry eye treatments, blepharitis. And on my past videos, almost without fail, I tend to get somebody that comments about Manuka Honey eye drops. They state how amazing they are. They almost make it sound like it's the end-all be-all for dry eye treatments or blepharitis treatments. And they pretty much would tell me I'm pretty much wasting people's time explaining or educating about other dry eye treatments or blepharitis treatments. And so it kind of rubbed me the wrong way at first, but I finally got my hands on some Manuka Honey eye drops and the gel. And I have to tell you, I'm actually really glad that I did, because these just might be the best natural eye drops that you can get for dry eyes and blepharitis. Let's focus in. So let me go over exactly what Manuka Honey is, what it can treat, what kind of drops you can get, and how you can get it. So what exactly is Manuka Honey? Manuka Honey is native to New Zealand, and it's made by the bees that pollinate the flower on the Manuka bush. That's why it's called Manuka Honey. The active ingredient in Manuka Honey is called methyl glyoxal, which has amazing antibacterial and anti-inflammatory properties, which sets it apart from traditional honey. And what's amazing, when you actually apply this to the eye, it creates this microenvironment on the surface of the eye, and it actually inhibits growth of other organisms. And because it has these antibacterial and anti-inflammatory properties, it's amazing at helping control the overpopulation growth on the eyelids, helping treat blepharitis. It can help control the overpopulation of Demodex on the eyelashes or the eyelids. It can help treat meibomian gland dysfunction, MGD, which contributes to dry eyes. It can help treat evaporative dry eye disease, aqueous deficient dry eye disease, or the combination of any of those diseases. Now, as the natural benefits of Manuka Honey have become more well known, a lot of people would take that Manuka Honey and actually make their own homemade eye drops to treat their dry eyes and blepharitis. Now, Optimel has come along and made the first commercialized eye drops, non-prescription eye drops that you can get and actually use on your eyes. The Optimel Manuka Honey eye drop does have less Manuka Honey in it. It comes out to be about 16.5% of the eye drop, and it actually does have a preservative in the eye drop as well. The Optimel Manuka Honey Fortified Eye Gel is a lot more concentrated, with about 98% of it being the Manuka Honey. So pretty much all Manuka Honey, and it does not have a preservative in the eye gel form. Now, because of the two different concentrations, I do think each one of them have a specific place in dry eye treatments. The eye drop, I'd probably say, is best for people that have mild dry eye disease. The eye gel will work great for people that have blepharitis, MGD, maybe more of a moderate or a severe dry eye disease, or even mild dry eye. The eye gel will work great. If you can't tell by now, I favor the eye gel a little bit more. It's preservative free, and I noticed when I used both of these, the eye gel worked better for me. Now, what's the best way to use these eye drops? Now, let's go over a few ground rules first. If you have an allergy to honey, you are definitely not going to want to use these eye drops. Also, wherever you read about Manuka Honey eye drops, they're going to mention that the eye drops will probably sting, and that is true. They could sting from 5 to 10 minutes, and then your eye should go back to normal. In fact, it should feel great. Now, if it stings longer than that, or if you have a more severe reaction than that, then definitely stop using the eye drops. Definitely go into your eye doctor. And that being said, definitely want to be working with your eye doctor, especially if you have blepharitis, MGD, dry eye disease, just so you and your eye doctor are on the same page, especially when working with Manuka Honey eye drops. Also, if you're a contact lens wearer, you definitely do not want to use the drops or the gel when the contacts are in your eyes. When you put the drops or the gel in there, you want to wait at least 30 minutes until you put the contact lenses in. So I'm going to walk you through how to put these in your eyes. I'll put the eye drops in one eye and the gel in the other eye. If you're hesitant about putting eye drops or ointment in your eyes, I did make some videos, some how-to videos, how to put eye drops and ointment in your eyes, and I'll put that in the description below to help you out. So you're going to open up the bottle and you're going to put it right on the inside corner of the eye, and make sure you bring the eyelid down so you get the full drop in there. Then once you get it in there, close your eyes and just prepare yourself, because it's gonna sting a little bit. So here we go. We gotta do this live. Doing it live. Here we go. There we go. Inside corner. Yeah, there we go. Woo, yeah. Okay, yeah, Not bad, not bad. It's not bad. It's not bad. Whoa, it's got the tears going though. Got the tears going. Not bad, not bad. We got this. So I'm gonna get a little up close and personal for the eye gel just so you can see how I do it. Now you can, just like the eye drops, put the gel in the inside corner of the eye and that is just fine. Just make sure you're not touching the eye with the bottle or the eye gel bottle. But what I like to do, I actually like to use a cotton tip applicator to apply it on the eyelids, and I'll show you here in a second. But if you want to do it this way, I'll put a link in the description below so you can get your hands on some of these because these are great. So you're going to open up the bottle and you're actually going to put a little bit right on the tip of the cotton tip applicator, the cotton swab here. And really it comes out like a gel, almost looks like you're squeezing honey out of a bottle because that's what you're doing. Now you can actually pull your eyelid way down and actually put it right on the inside of the eyelid, but I actually like to put it right on the eyelid margin where the base of the eyelashes are because I want to try and target the meibomian glands for meibomian gland dysfunction. Also, you can target your blepharitis a little bit better. And so you're going to pull your eyelid down a little bit and you're going to just rub right on the base of the eyelid. And you can rub it almost like you're putting on a makeup. I don't know what that's like, but you can put it right on there, nice and smooth. And right off the bat, right off the bat, this one definitely stings more than the eye drop for sure. Wow, that one gets the waterworks going. Yeah, right off the bat, that one's good. Still not bad, still not bad, but eyes are watering for sure. Still not that bad. See, it's already feeling way better. But yeah, that gel, that honey gel, as your tears start flowing, it will kind of dilute the gel a little bit and spread it across your eye. I like to move my eye around a little bit. And that will coat the eye and create that little microenvironment like I was talking about earlier. And yeah, you can just feel it kind of coating the eye. And yeah, the sting, the burn is already getting way better. So it can last up to 5 minutes, but I mean, just a few seconds with me. Yeah, eyes already feeling way better. In fact, the sting, burn, pretty much almost gone now. Yeah, it's great. But yeah, you can actually feel it just kind of dissolve, almost melt in your eye, and then it coats the eye. And then, yeah, after the sting and burn's gone, it actually feels pretty good. The drops are designed to be used up to 3 times a day. 16 years and under needed to be consulted with a doctor. And once you open them, you want to discard the bottle after 2 months. The gel is designed to be used twice a day. And again, you can use this directly on the eyeball or the eyelids. And again, once you open the bottle, 2 months later, you're going to want to throw the bottle away. Now, I actually started noticing improvement pretty fast after I started using the gel form. In fact, I was actually pretty surprised. And so this is definitely something that I do highly recommend at least trying, getting your hands on Manuka Honey and trying it in your eyes, because it actually did shock me. I'm glad people commented on my other videos and told me and pushed me to get this, because it actually does work really well, at least it did for me, and it's something that I will definitely be recommending to my patients. Now, where do you actually get these drops? And to be honest, they can be tricky to get if you live in the United States. And I'll put links in the description below so you can definitely check those out. You can get them on Amazon. They're a little tricky there. Sometimes they're out of stock. The shipping can take a while. Sometimes it can be expensive. The best place that I found and where I got my drops was eyeherb.com. That's probably where I'd say go get these eye drops. It's definitely the best place that I found. It's the cheapest and the shipping was crazy good, way better than Amazon. I was actually shocked. And so I put that link in the description below. If you're in the United States, check out eyeherb.com. You can get these pretty easily actually. Now, if you're looking for more specific ways to treat your blepharitis, you definitely want to check out my video right there, or dry eye treatments, check out my playlist right there. Stay focused.